Claims in relation to a communications contract continue to dog the Health Minister, Dr. Zweli Mkhize. It was announced this week that the Public Protector, Busisiwe Mkhwebane, will initiate contempt proceedings against Mkhize over his failure to honour a subpoena. She reportedly subpoenaed him, in fact, 3 times to give evidence to produce documents in relation to her probe into claims of an undue delay or failure on the part of the Health Department to implement the recommendations of a report. Now, this report is about clinical associates. Clinical associates are mid-level healthcare workers who work under the supervision of doctors, often in rural areas. A team was established by the Health Department to review lessons learned during the training and appointment of hundreds of clinical associates. But a complaint was laid by clinical associate Sanele Ngcobo, who says that nothing has been done. Ngcobo is also the General Secretary of the Professional Association of Clinical Associates of South Africa. He joins us now. Mr. Ngcobo, thank you for being with us. Firstly, is the Public Protector's Office engaging with you? But they were reportedly going to open that case of contempt. Do you know if that has happened?
Thank you very much, Francis, for hosting us. Maybe I must start first by thanking the Office of the Public Protector for giving us an opportunity for listening to us. Francis, we have been through many different platforms trying to engage with different stakeholders, including Parliament, including provincial departments, including the National Department of Health, and many other different platforms, but no one was willing to listen to us, including the Public Service Commission. We've been through all those. So now, to go straight to your question, I think that the Office of the Public Protector is really helping us, and they have been communicating with us that they are now taking steps towards opening a case against the minister in regards to the issues of clinical associates, because this issue has been dragging for quite some time now without getting a required cooperation from the side of the Department of Health.
All right, so we'll follow that. Before we look at the report that you say hasn't been implemented, so people can understand, tell us what you do as a clinical associate.
That's a very good question, Francis. So a clinical associate, maybe just to give you a bit of a background, around 2001, the administration at that time realized the shortage of healthcare workers in general and doctors in particular. So what they then did was that they went through different countries across the world, through Kenya, through US, and many other different countries where this particular profession is offered. And then they came back and they started working towards introducing this profession into South Africa. It was then introduced around 2008. The first cohort was introduced in Witwatersrand University, and the second cohort was introduced at University of Pretoria and Vet University. I was in that group in 2009. So now, a clinical associate, these are professional members of the healthcare team whom were brought into the healthcare system to strengthen the healthcare system, realizing the burden of diseases in South Africa and the huge shortage of healthcare workers in general and doctors in particular. So clinical associates, what they then do, maybe just to take you through what we do on daily activities. If you were to go to a clinic today and you were to find a clinical associate, or if you were to go to a hospital casualty today and you were to find a clinical associates are equipped enough to be able to take history, to do physical examination, to then do investigative studies, and then to also write a prescription and then give you whatever medication that you actually require. So these are healthcare workers with skills who focus mostly in terms of making sure that they give clinical care to our patients. So
what would a doctor need to do that you can't do?
Okay, that's a very good question once again. So just also to give you an example, because now we have asked about doctors. So doctors do what we call a Bachelor of Medicine and Bachelor of Surgery. This is what we call a 2-in-1 degree. So they do 2 degrees, but in 1 degree over a period of 6 years. Clinical associates do Bachelor of Clinical Medical Practice. So what doctors do, which we don't do, is that their training is obviously longer than us, and then we as clinical associates, we act under a supervision of a qualified medical practitioner over a specified period of time. So for some complicated issues which clinical associates might not be able to handle, they then refer those to clinical associates.
All right, Mr. Ngcobo, tell us about your complaint to the Public Protector. Why are you concerned about this report not being implemented around clinical associates? What were the findings that you think are important?
So we are saying that we are speaking on behalf of the people of this country. We are speaking on behalf of patients in this particular country, where there is a huge shortage of healthcare workers. So now, the clinical associates, when they were introduced, there were many things which were never planned properly. So this includes the issue of a job evaluation. So in the task team report, which was done by the National Department of Health, there was a specific issue towards making sure that a job evaluation is done to evaluate the job of clinical associates, because we understand that when this profession was introduced, there was never a proper process towards doing a job evaluation. There are issues such as prescription. So clinical associates, by the scope of practice, are allowed to prescribe, but because of the issues of because of the issues of medicine control council, they are not currently allowed to prescribe, even though the scope of practice allows them to prescribe. Imagine you are having someone who's qualified to prescribe medication, but because of the Department of Health, currently clinical associates, when they are prescribing, they have to go and look for a counter signature of another professional.
All right. Unfortunately, we've lost him there, but you get the gist of this report, that clinical associates was never implemented by the health department, so they can't write out prescriptions and things like that, even though they are trained to. And because of this, the public protector instituted an investigation and subpoenaed the health minister. He said he was unable to pitch 3 times, so now she's looking at laying a contempt of court charge. That was clinical associate Sanele Ngcobo, who is the General Secretary of the Professional Association of Clinical Associates of South Africa.